Hello, everyone, and welcome. So, I am Dr. Erika Cini. I'm the program director for the MSc in Eating Disorders and Clinical Nutrition. I'm just tell you a little bit about me. So, I'm a consultant child and adolescent psychiatrist, and I am an eating disorder psychiatrist. And I work in East London mainly clinically, and I lead an eating disorder intensive program. In addition, I'm also a clinical academic, and part of my role as a clinical academic is leading this program, which is a unique program all across the world. And in addition, I also do some strategic leadership stuff working with NHS England, the London region, and proposing and developing the London mental health strategy. So, welcome, and it's great to hear that you are interested in our MSc. And what I'm going to do is I'm going to talk through some slides to let you know a little bit about our MSc, what we do, a little bit about eating disorders as well, and talk you through the different modules. At the end, we'll have a time for questions, and I will also share my booking link just in case you want to book a one-to-one session to ask more questions about the program. So let's get started. So just to kick off, we just make sure we're on the same page about what is an eating disorder. So an eating disorder is a serious mental health condition, and this commonly affects eating behaviors, thoughts, and emotions. Eating disorders are not just about food. It involves complex interactions between our genetics, the way we're made up, our psychological and our psychosocial factors. And I've got this little diagram here that you can see on the right-hand side, which shows how all of these different interactions come together to then predispose an individual to developing an eating disorder. Overall, the core features of an eating disorder include disturbances in eating patterns, so things like restriction, binging, and purging. Behaviors are some examples. Some, but not all, eating disorders include distorted body image or preoccupation with weight and shape. And all eating disorders have a significant physical and psychological consequences and impact on one's daily living. So they're quite serious. And actually, another thing that we know about eating disorders, there's one of the eating disorder, one of the most common eating disorders, anorexia, or one of the most well-known, I should say, rather than most common. One of the most well-known eating disorders, the anorexia, is actually the most deadly disorder in mental health, with 4/5 of the deaths happening because of physical consequences and 1/5 because of psychological consequences. So as you can see, it's very important to know. As I was saying, the two most common, the most well-known eating disorders are anorexia and bulimia, but actually the most common are the other two, the binge eating disorder, which was included in our diagnostic and statistical manual since 2014, and other specified eating and feeding disorder, which used to also be called in the earlier versions of our classification, psychiatric diagnosis classification, eating disorder not otherwise specified. There are some other types of eating disorders, such as ARFID, rumination disorder, and pica, which initially used to be considered and classed under feeding and eating disorders, but now these have been combined to make one chapter within our diagnostic manuals. And all of these, particularly the ones on the left-hand side with the title Main Types of Eating Disorders, are the ones which are most commonly seen as the bread and butter of eating disorder services. And the ones on the right-hand side are dealt with either by an eating disorder service, by pediatrics, or by generic child and adolescent mental health services. Though there is a drive to try and incorporate them and to equip more community eating disorder services to take more of the feeding and eating disorders within their service criteria. So one might pause to think, why are we making such a fuss to recognize, and why are eating disorders so important? Well, as I already stated, they have a high morbidity and mortality. We also know that with eating disorders, the earlier you recognize and you start evidence-based treatment, the better the prognosis and the outcomes that you have. So therefore, reducing the burden on the individual, on the family, but also on the healthcare systems. A lot of the time, it's a very hidden illness. So despite knowing that early intervention improves outcomes, the fact that it can be quite secret in the presentation, people feel ashamed, shy, don't want to say, that in itself can be a barrier to accessing care. And because of that, again, patients who suffer from eating disorders tend to find it harder to engage with services. So again, if thinking about equity, access, thinking about how culture, different ethnicities impacts on how eating disorders present, it's really important to make sure that we have professionals like you guys who are interested in coming on the program, who are aware of all the different types, symptoms, and presentations, so that we can recognize these disorders and avoid patients being passed from pillar to post, so that it would be better for patients, healthcare systems, and all involved for patients to get recognized, seen, noted, and treated as early as possible. So we spent some time to think about the prevalence of eating disorders and what do the trends show us. So overall, we know that eating disorders present mainly in the adolescence and early adulthood period. And we know that we're seeing a rising prevalence across the world. So it doesn't mean that it's only, there used to be this myth that eating disorders only present in white, middle class, females. We know, and it's very clear through different studies, that eating disorders can present regardless of gender, regardless of sex, regardless of ethnicity, though the presentations may vary slightly. We know even across socioeconomic demographics, all of those can also have eating disorders, and we can also see different patterns of eating disorders across these different demographics as well. And what we know is that by 2040, the prevalence globally is anticipated to increase even further, with estimated prevalence going up as high as about 373 per 100,000 population. And what all of this shows us is it's really, really important that we detect eating disorders earlier, we offer accessible treatment, and that we tailor our interventions to fit a global presentation. If we zone into the UK, and then again, we see a similar picture where the incidence shows trends of eating disorder presentations increasing over time. And you can see, even if we look across the age span, there are big jumps in presentation, prevalence, and incidence. One of the most more noticeable jump was in young people aged 17 to 19, where back in 2017, we had a rate of about 0.8%, whereas this shot up to 12.5% post-pandemic, so in 2023. And again, if you look at the graph on the right-hand side from the Children's Commissioner for England, again, what you see there is a year-on-year rise in hospital admissions. So not only is the prevalence and the incidence of eating disorders increasing, but also the acuity. So let's zone in a little bit about what this program offers. So as I said, this program is the only program on eating disorders and clinical nutrition worldwide. It was started in 2012 by Professor Robinson, we're very lucky to still have him on the program. And another great asset of this program is that successful graduates can apply for registered associate nutritionist status with the AFN. So that's an added plus. In terms of background, it's suitable for graduates with a science background, students from medicine, psychology, nutrition, dietetic degrees are all welcome. it's helpful to have that science background because the nutrition modules in particular have some added details on biochemistry, Krebs cycle, so some background knowledge is helpful. And our students have gone on to study medicine, dietetics, psychology, have become specialists in eating disorders. However, others have also taken an academic path and have gone on to apply for a PhD and postdocs. And a lot of them have obtained jobs in eating disorder services and at universities. The program is offered as an MSc, both full-time and part-time, and it's also offered as a PG Cert and a PG Dip for those who do not want to go all the way and complete the full MSc. In terms of modules, sorry about that, we share 6 modules with the MSc in Clinical and Public Health Nutrition. And the reason we share this is because of our accreditation with the Association of Nutrition. So we do need to cover a breadth and we need to have a solid foundation of clinical nutrition. However, as a specialist working in eating disorders, I can also tell you that having that foundations in nutrition is really, really important clinically because it really puts you a step ahead of other clinicians who may lack that nutritional background. So that is definitely an asset. And then we have 3 specific modules which are on specifically just on eating disorders. And even though there are 3 modules, they do form half of the credits, so 90 credits of the whole MSc. And these are the clinical science, the management module, assessment and treatment, so management module, and the research projects, which I will be talking to you about in more detail in the coming slides. So in term 1, you will also be having the MEDC 41 eating disorder clinical science module in addition to the nutrition modules. Whereas in term 2, you'll then be building on that knowledge and have the eating disorder management module and your 3-day observational clinical placement in addition to the remainder of the nutrition modules. Across the terms 1, 2, and 3, we will offer you to join one of our research groups, and you will be allocated to a dedicated supervisor to conduct your dissertation. If we spend some time just thinking about what are the nutrition modules before I go into a deep dive into the eating disorder specific modules, you then have the fundamentals where you learn the nuts and bolts of nutrition and metabolism, followed on in term 2 by the therapeutic aspects of clinical nutrition. There are then added modules such as disease and disordered eating to help you think about nutrition more as a holistic aspect, which is very important to help you think more broadly than just eating disorders. There are some practical nutrition assessments where you get to work in a lab and do some experiments to see how different anthropometric measures are used. You get to see what malnutrition looks like in a community setting, and there are some visits to different sites in that module. And then you also have the nuts and bolts of experimental design, research methods. You'll be doing your good clinical practice as part of MEDC 39. So going back to the eating disorder modules. So the clinical sciences is the learning objectives of this module is to comprehend the interplay between the genetic, environmental, psychosocial factors in the development of that eating disorder. By the end of the module, you should be able to examine the neurobiological mechanisms which underlie and underpin eating disorders. And in this, we'll also be thinking about brain regions, neurotransmitters, and the neurocircuitry involved. You should be able to understand the role of the cognitive processes and the neurocognitive deficits that arise as a result of eating disorders. You will be able to recognize the developmental trajectories because we teach the program across the lifespan. So we'll be thinking about it in children, adolescents, adults, and older age. You will be able to understand the comorbidities and the associated mental health conditions and evaluate the long-term outcomes of eating disorders. So you'll be thinking about recovery rates, chronicity, and relapse prevention. So just to give you a bit of a, just to give you a little bit of a flavor of some of the topics in this, and you'll have things like, eating disorders in adults and children. You'll have a session with an expert by experience. We'll be talking about how do and what causes an eating disorders. We'll be talking about what changes medically and physically happen when someone has an eating disorders, both to the brain and to the other organs. So we'll be talking also a little bit about neuroimaging. And we'll also be thinking about some cutting edge lectures, so things like psychedelics, ultra-processed food, eating behaviors, and more. In the second term, we'll be thinking about management. So now management covers both assessment and treatment of eating disorders. And the learning objectives for this module are to identify and describe the eating disorder presentations and symptomatology. You should be able to explain how you conduct an assessment for an eating disorder, both in children and adults. You would be able to describe and differentiate between various therapeutic modalities in eating disorders. And some of you will also be given the opportunity to go on some additional courses where we talk about these in more details. So at least it gives you that overview about the different therapeutic modalities that are out there. Another objective is to distinguish the diversity in the roles of the multidisciplinary and multi-agency working. And finally, by the end of this module, you'll be able to critically appraise the pros, cons of the different therapeutic settings. So we'll be thinking about, well, where do we deliver services? So if you're an international student and maybe you don't have eating disorder services in your country and you want to think more broadly about service design, service development, this will set you up in good stead to think about what the different options are. So again, thinking about the timetable, again, this module is mainly held on Wednesdays, and they are supported by tutorials, which tend to be held on Mondays. So this is for both of the eating disorder modules. And as I said, we'll be thinking about, I mentioned here some of the therapeutic interventions that will be touched on. We'll be talking about physical health management because, you know, as I mentioned earlier, it's really important to think about a patient with an eating disorder holistically, so both their physical and psychological aspect. We'll be talking about do medication work and what's the role of medication in eating disorders. So quite a few different topics. And then there's the placement. So this is just a 3-day placement. And the aim of this placement is to help you to see in practice what is being taught in the classroom. So you'll be able to sit in team meetings, observe the eating disorder team during when they're assessing and reviewing patients. And you'll also be able to discuss career prospects with some of the team members. So again, I appreciate it's only 3 days, but it is helpful to help you see things from a clinical perspective. Throughout terms 1 and 2, we also run tutorials. These are online, and this was a decision made in conjunction with past students where they prefer the tutorials to be online. And the aim of these tutorials is very much to consolidate the main learnings from the lectures. We run them on a basis of combination of problem-based learning, thinking about case-based discussions. We talk about how do you present at conferences, and we also get in some external speakers to also talk about specific topics such as ethics and have a discussion around it. So quite a rich experience. Last but not least is a dissertation project. So this is a 10,000 word dissertation. And the overall aim is to give you those skills and knowledge that enable you to do confidently a research or a service evaluation or a clinical audit or a service audit or a service development or evaluation project alongside an experienced dissertation supervisor. We tend to offer set topics. That is not to say that you can't choose your own topic. So we do have some supervisors who offer student choice projects, but we also support students by offering set topics. And this would mean that you either can join in an existing research team, so it gives you that additional perspective, but also it gives you that safeguard that we know that that project can be completed and started and ended and completed within the year, because we know that in an MSc, especially those who are doing it full time and even those who are doing it part time, you have to condense everything into that 1 year. So I'll stop talking there and I'll wait to see if there are any questions. Nice to see you all. Any questions? And feel free to turn your camera on. And you can unmute yourself, I believe, Emiliana said, and ask the question. So May's asked, will any group work be involved in this MSc? Yes, we do have group work in quite a few of the modules, and there are some where you get allocated into groups. For example, I'll give you one example is a poster presentation where you work in a group to produce a poster and then to present it to the examiners. Another example is the video project, where you produce a video podcast together with a group about specific topic. And there are also some case-based discussions. Hannah said, how much experience is required to apply? Hannah, can you unmute yourself? In what sense, what type of experience are you referring to? Maybe Hannah can't unmute herself. So I'm not sure what type of experience. I think in terms of research experience, I mean, you do need to have, a basic university degree. We expect a 2-1. There's no clinical experience that is required, but we do expect you to have engaged in an academic project as part of your undergrad dissertation before joining the MSc. But feel free to unmute yourself if I've missed any other experience that you are perhaps referring to. Okay. So I don't know if I'm pronouncing the name right. I think it's Gizem. Hello, I can't turn my camera on due to a technical issue. Emiliana, I will leave that with you. Thank you for letting us know, Gizem. Did you have a question that you wanted to ask as well? And Hannah, I can't unmute, sorry, but based around work experience. Yes, so for this MSc, no, we don't require any work experience. But I appreciate that's a good question, because some MSCs and some programs do, but this one isn't one of them.
Hello.
Hello, hi Priya.
Hello. So I'm from Bangladesh, and
Hello.
I'm from Bangladesh, and I actually have already completed my master's food safety and public nutrition, where my focused on genetics of possibility of type 2 diabetes mellitus with its progression towards cardiovascular complication and CKD complication. Then I started to work as a nutritionist, and that's the time when I started to notice the hidden pattern of different types of eating disorder, and that's why I decided to do my second master's on it. So I wanted to ask you if it's possible for me to pursue my second master's in this topic.
I think if you would like to specialize in eating disorders, yes, absolutely, this would be the masters to go for. So it's not uncommon for people to have done a previous master's. It's not very common, but we do we have had students who have done a previous master's before, then wanted or found an interest in eating disorders and then did this master's. So absolutely, you could do that. And then you could also say that you can also work as you have that special interest in eating disorders as well.
Um, I have another question actually. Eating disorder, I want to ask that when we are doing research on eating disorder, do we account the influence of the viral diets, like the influence of social media? Because when I was working as a nutritionist, I could see that people with anorexia reluctant to weight gain because they wanted to like a particular celebrity. So in that case, this module will look into the more influence on the eating disorder. That's something I'm really focused on.
So Priya, I can't quite hear you properly because I don't know if it's just me or if it's my side, but I can hear like every other word. So I can't hear you fully. I think you said something about social media and eating disorders. I know that previous past students have looked into that and thought about a systematic review looking into social media and eating disorders and the impact of it. So yeah, I think that would be a nice, interesting dissertation project, absolutely. But I'm not sure if I understood fully the question. In the meantime, until Priya tells us, Cedra is asking, as a nutritionist, is the career path mainly academic after completing the program, or can we work clinically with eating disorders but with additional qualifications? I said, apologies if I wasn't clear. So with this master's, the route forward is twofold. So we have had people who have then gone on to go follow a clinical pathway, and then once they've completed their clinical degree, they can say they are whichever degree they would have followed, and this master's, which would sort of rubber stamp them as having a special interest in an eating disorder, because it would give you that comprehensive knowledge in eating disorders and clinical nutrition. On the other hand, we've had other students who have absolutely, as you said, followed a more academic pathway, done a PhD, postdoc, etc. We've had some interesting careers as well. So we have, I have one student who became a podcast, and she sits on different also clinical advisory groups and talks and advocates a lot about eating disorders. Her podcast is Full of Beans, it's called, so you can have a look at it. We've had other students who have written books about eating disorders. We've had other students who have finished their medical degree, become psychiatrists and then use this as a special interest. We've had others who have become lecturers. We've had others who have become ward managers, others who have gone and worked in industry and thinking about eating disorders in that way. So quite a range of students. Are there many exams? Yes, there are exams within the program because we have a policy at UCL around having AI-proof assessments in order to keep the standard of the programs as well. So we do have exams, absolutely. Great. So I've answered all the questions so far. Are there any other questions? Do I need to secure a supervisor? So as I mentioned in the dissertation project, the supervisors offer specific topics, and you're encouraged to choose one of those topics. There are some supervisors who offer a student choice project. So if you have a really burning need to do your own project, then you can choose one of those. And then projects are allocated on a matching process whereby students choose their top 10 and supervisors also choose their top 10 and then they're matched. So we provide all dissertation supervisors. Someone else asked, hi, I had a few more questions. What will the cohort size for next year be? Is this MSc more lecture-based or small classes and workshops? So the cohort size can be anything from 15 to 30. We try to limit the number to 25, 30 students, but we have run courses with 15 students. And is this MSc more lecture-based? I think it's a mixture of different types. So we have didactic lectures, we have groups, we have poster presentation, we have oral presentation, we have video tasks. So in terms of the pedagogy of the program, it's quite varied. And we also have tutorials, which would be the smaller class teaching. Any other questions? Okay, great. Well, if there are no other questions, and I can't see any in the Q&A, I can't see any hands up either. You have my link, I think. Yes. Thank you, Emiliana. She's dropped it in the chat. So you can book a one-to-one session with me if you have any additional questions that maybe you feel uncomfortable to share in a group, and we can have a chat one-to-one. And I look forward to seeing some of you on the program. Thank you very much.